Get yourself a beautiful smile. With beauty, class, and style, you can realize your dream and improve your self-esteem when you go to the Snow Orthodontic team.
So when a patient is 6 years old or 7 years old and comes to the orthodontist, normally what would happen is the orthodontic will take a panoramic X-ray to check for an eruption pattern of teeth, to check for crowding, and also checking the bite. There is the California Association of Orthodontists has a brochure called Bite Down, in which is a little ruler, and if the measurement goes beyond, I believe, 3 millimeters, it's advisable for the patient to start treatment at that point in time. So again, one of the things that we see is for large overbites or large underbites. Those are best treated at an early age, especially the underbites are critical to be treated when the patients are about 6 or 7 years of age. Other things that we look for are teeth that we call they're not coming in the right way. They're coming ectopically, meaning they're not coming in straight. The most common teeth to do that are the upper canines. Sometimes just by starting early and removing some baby teeth and allowing for the teeth to have a better path of eruption, we can eliminate potential problems like impactions, where if we wait, later on the oral surgeon has to open the tissue, place a bracket on the tooth that has a chain attached to it so we can bring the tooth down into place. A lot of the times severe crowding can be very easily resolved by doing what's called serial extractions, which means removing some baby teeth in a serial manner, and at the end removing 4 permanent teeth to allow for the rest of the teeth to have enough room to come in and eliminate a potential problem down the road. Sometimes just doing expansion of the arches or developing the arches allows us to make room for all the teeth and eliminate the need for extractions of permanent teeth down the road. That's why a lot of the times orthodontists like to start early in what's called a phase 1 treatment, so that this can be resolved at an early age. For adults, it's also very important to do orthodontic treatment. The reason is to seek orthodontic treatment, and that's not so much the aesthetic value of it, but also the hygiene and health benefits of the teeth. Teeth that are crowded are a lot more difficult to clean, they're harder to brush, especially to floss, and that leads to inflammation of the gum tissue, which leads to bone loss, which leads to gum disease. There's been a lot of studies lately that link periodontal disease or inflammation or bone loss to systemic diseases such as respiratory disease and cardiovascular disease, and even low birth in babies and moms that are expectant, all as a result of bacteria that is transmitted into the bloodstream from periodontal disease. So again, if adults think, well, I've had my teeth crooked all my life, it doesn't matter, I don't care, there's health benefits, not so much health benefits of the teeth, but systemic health benefits. Being a kid or an adult is very important to keep all the appointments. This way, treatment will progress in a timely manner and you'll be done on time. Patients that constantly miss appointments or break brackets in between appointments extend their orthodontic treatment, and for that reason they're not being finished on time, and have other potential problems such as resorption or possible periodontal problems from lack of brushing and flossing with the orthodontic appliances. Also, it's very important to not only to keep your earlier appointments, but to come into your appointments on time. This way you help the orthodontist maintain the schedule properly, and everything that I wanted to be accomplished in that visit can be accomplished, rather than to limit your appointment to a shorter visit because of the patient didn't show up on time. It's to the benefit of the patient, to the benefit of the orthodontist, and to the benefit of all the other patients that are in the waiting room waiting to be seen.